Good afternoon. It is time to start our press conference once again on the COVID-19. And as we normally start, I'll ask you to bow with me in prayer, please. Dear gracious Heavenly Father, we thank for this day and all the many blessings. We thank you for this opportunity as community leaders to come forward, Lord, and hope we pray that we make all decisions in accordance to thy will. And we pray that you give us the knowledge and wisdom that we need to lead our community forward. Lord, we pray for our country and the men and women that serve our country, and especially the ones that are on foreign soil, that if you will bring them back home safe and sound, and if it be thy will. Lord, we pray for the sickness here in Overton County, and especially the ones that have been touched by this deadly virus, Lord, and we pray that you comfort them as only you know how. Lord, we ask you to forgive us of our sins. In Christ's name we pray. Amen. So today we have with us Mr. Ben Danner, Overton County Executive, Ms. Megan Reeder from the Overton Health Department, along with Andy Langford from the Health Department, Mr. Greg McDonald, Ms. Shannon Cantrell from the Chamber, Mr. Tim McGill, Livingston Regional Hospital, Mr. Scott Stevens, Overton County Health and Rehab Center, and Dr. Mark Winningham with the Overton County School System. So, and we will be in no particular order. So, first, as far as the city, there is no new reports. We are still waiting on if there is going to be fall baseball / softball or not. Kind of taking going to take a lead from TSSAA or the school system to see if they're going to allow audience, spectators in the stands, and what the case may be. I think we'll hear more about that from Dr. Winningham here shortly. So next I will have Ben Danner, Overton County Executive. Ben? And also, after each one speaks, if the media here has any questions for them, we entertain those questions, okay?
All right. Thank you, Mayor Hayes. As far as the county, I don't have any new announcements other than all the offices are still open. The community center is probably going to be shut down through the end of August, and so is the ag building. Early voting is starting this Friday. So, I think some of the regulations from the state, we'll just have to see how that goes. If something happens, if someone has the COVID and the people in the election office get that may be the time when they shut the election down. So I don't really know how that's going to play out. But, I know the governor gave it to the county, the authority to mandate masks, and we didn't do that. I didn't feel like, that was the right thing to mandate. Now the governor says that they just want people to buy in and they're trying to wear the mask. I just like to tell everybody, if you're in a crowd, that would be a good idea. If you want to wear a mask, I think you should, but I don't feel like I have the authority to mandate that, make every person in the county wear a mask. I know the numbers keep going up. I hope when the vacation season's over, we've got a lot of people going to Florida and places like that have high numbers, and maybe the numbers here will start going down. But as far as that's all the updates I've got from the county. Do y'all have any questions?
Being the license tags, are they still?
They're still open. The governor ended where they give you a couple months. They're still, we're open just like we were before. I know we get calls every single day. We won't know when we're going to open, but we've been open for 2 months now. So, but every office is on regular hours. So now the court offices, you've got to wear a mask. The Supreme Court passed, you have to wear a mask if you come to court. You have to wear a mask if you go in Barbara Matthews' office or Dorothy Stanton's, and they've got the glass where you don't come back into the office with them. So that's mandated by the Supreme Court. So as far as the only mandates I know as far as the county goes. So
if your time tags are expired, is that you still have to go get them renewed, or
they give you a grace period during the shutdown, but not now. If they're out, you've got to get them renewed. So y'all have any
new building?
And the new building, the COVID has finally struck the new building. We're behind 2 weeks now. Some of the crews from another area tested positive, so that put us at least 2 weeks behind. We were looking at August September now. Of course, we had a lot of, supplies come in, and that's been delayed because of the COVID, so, but we were still looking like we were on time, and we still might be close to the end of August, but that's put us behind a couple of weeks, I think, so. So for long, the fence will be coming down. They're getting ready to start doing, I know everybody's seen where they're cutting out the pavement. That's where the sidewalk's gonna come out too. And they're getting ready to start backfilling, so the fences will be down, and, cause everybody's asked, when are you gonna tear the wall down? We're about to tear it down, so, all right, thank you.
Thank you, Ben. Okay, Mr. Andy Langford and Miss Megan Reader, whoever's first.
I'm Andy Langford, I'm the Director of the Health Department. I want to talk a little bit about stats, numbers. I want to try to make a little sense of where we are, where we've been in this 4-month journey here with COVID-19. You can look these up on the tn.gov every day, check the numbers. They've added so many different numbers and things that you can look at. So I'm going to try to break it down in a little bit simpler terms. As of yesterday, the state of Tennessee, we have 66,788 cases of COVID-19. Across the state, we've tested 1,071,320 tested. One way to break this down and look at it is to try to look at the infection rate by taking the cases and the positives and those tested as well. We look at what we have is about a 6.2 infection positive rate. We've been looking about at the last couple weeks here in July. The thing to watch on that is we'd like this infection rate to be in the 3, 4, 5% range. It has been over time, but we've seen a slow rise in this. Over the month of July, over a 2-week period so far, across the whole state now, this is not Overton County, I'll break that down in a little while. We're now hovering around 9% on our positivity rate. That means almost 1 of 10 people we're testing, ourselves, the hospital, local physicians, all testing sites, one way or the other, 1 in 10 are positive. So we've definitely seen a positivity rate trending up in the last 15 to 30 days. We actually had a spike one day last week where we were at 11%. That was due to we had so many backlog cases that day of test results that came out that those all showed up on one day. So you can't look at this by day. You need to look at moving trends. You need to look at 3 or 4 day trends, something like that, or weeks at a time. 9% though is a high rate, and it is continuing to rise. So this is a little bit troubling for us. In Overton County, we have 80 cases over this 4-month period. We've tested 2,500 people, so that gives us an infection rate of about 3.2% infection rate over the 4-month period. Looking here in just July, we have 23 new cases, and we've tested 378 people. So our infection rate is now up over the last 2 weeks. We're sitting at about 6%. We've almost doubled our infection rate. Now we're a little bit lower than the state, but this is the trend that we're seeing almost everywhere. And I think we'll continue to see too, that we need to try to do everything we can as citizens to put a stop to. So what can you do? What can I do? What can we do as citizens? These are some of the same things that we've been talking about and heard about, but we need to remind everyone it's really important that we physical distance, social distance, physical distance, whatever you call it. When you're around people, when you're around family units, when you're around big groups, especially when you're inside, you're more susceptible the longer period of time you're around them, especially if you're within 6 feet of someone. Over 10 minutes, you're more susceptible to catch the COVID-19. Hand wash, good hygiene. I can't stress enough, face coverings or masks. Studies have shown that coverings can help mitigate and slow the spread of this disease. It also helps protect yourselves, your loved ones, and your fellow citizens. This is the easiest tool that we have in our toolbox to do something with. If we really want to help ensure we go forward and not back, we please ask that you work with us on following, doing the best you can on these guidelines. We're entering here some different phases with schools opening, businesses up and running, as you mentioned, summer vacations. It's hard to do these things. You get fatigue, you get COVID fatigue. We understand that, but we've got to stay diligent. This is not going away, and it is going to continue to be here, and we'll see a rise if people let their guard down. The key to businesses staying open, the economy staying open, schools staying open, is practicing and doing the best we can on these guidelines that are in place by the CDC and Tennessee Department of Health. It's as simple as that. We're all in this together. This is not political. This is all about citizens trying to work together to solve this problem. I'd like to talk real quick, free COVID testing daily. We continue at the Overton County Health Department from 9 to 12, done at a drive-through, set up, in and out very quick. We tested 48 people a day or two ago. We're testing 20, 30, 40, 50 a day. It depends. We are getting our test results back anywhere from the lab within 3 to 7 days. If we get what we're seeing is we get a couple of positive test results back. Those people get notified. Family members come in to get tested. Businesses are impacted. The people that are working there, they come to get tested. Agencies. One way or the other, I think we'll be sitting here in a few months and saying that one way or the other, everyone in this community is going to be touched by someone or somebody that they know has had COVID, or that they know somebody who's had it, or one or second or third person contact, one way or the other. We're beginning to see that a lot more out here in all of our Upper Cumberland counties. I also want to remind everyone that we have free masks at the health department. We'd like to come by, get a mask for yourself, your family, if organizations feel like they need them for their businesses. Call us at the health department. We have these. I did see today, just before I came over here, that it looks like Walmart and Sam's both are going to be requiring people to wear a mask when they enter their facilities beginning July 20th. Costco's been doing this for about a month. Several businesses are already doing this. I know a lot of people already have a mask, but we have masks. It's an easy thing to do. It's inconvenient, we understand. But we have masks if people want them, so please contact us or come by. We'll be happy to provide those as needed. I'll be happy to take any questions as well now or later on. Thank you. Yes?
Here in the community, I'm still hearing people compare this to the flu. And do you have anything to say to reiterate the seriousness of COVID-19 versus the flu?
I'll let Megan talk to that, but I'm going to say a couple of things just from my viewpoint on what I believe. Here's the problem. We know what the flu does. We have the flu every year. We know how to attack it. We know what to do. We know how it impacts our communities. There are many times where the flu fills up our hospital beds and ICU units in our hospitals are full due to the flu and other things. Okay, that's going to be there. That's a given. We know how to work with that. We don't know everything, and we're finding out something new every day about this COVID-19. We don't know how it's going to impact someone that has it now in their lungs in 10 years. We don't know the respiratory problems they're going to have. We don't know how it's going to impact their neurology, in brain functioning. There's so many things that we don't know, but they're sitting there that we don't want people to have to be dealing with health problems down the road. The way this can spread is it is so infectious as well. more so probably than a lot of the flu strains. Each flu strain is different. So the infection rate, the way we've seen it spread between communities, clusters, it's new, but it's more than just the flu. The death rates that we've seen and how it impacts elderly people, but not just elderly people. What we're seeing now is a spike in people 20 to 40, and they may not have symptoms, and they may feel fine, or they may, but then if they pass it on to someone else, then they're inadvertently passing on grandparents, parents. They don't realize that, they don't think about that. But if they had a fever or the flu, then they would not be around those people probably. What's any different? Medication-wise, we know how to treat the flu. We know we have Tamiflu, we have flu vaccines. We don't have anything for this right now developed. They are working on therapeutic drugs. They know that there are some that are out there. You've heard different, I'm not going to get into vaccine trials, and that's coming. There are also therapeutic drugs that are there that they know that if someone gets sick, it'll help them be better. So many unknowns, and we're dealing with in a dangerous situation with it. So those are the main distinctions that we like to point out. The scary part of this is when we get on into fall and you have flu and upper GI and strep throat and regular sickness and cold in people, and then you put COVID in there with it, then we're looking at a very it can become a very sticky situation. So Megan can kind of elaborate a little bit more on where I went with that. Thank you. Thank you.
Thank you. Amy actually answered that very well. As far as your question, that is the big thing. The infection rate is much higher with this. As he said, we know a lot of the things that's going on with the flu. Whereas COVID, everything's new. We're learning as we go. We don't know the long-term lasting effects of this illness. We do also know that COVID-19 causes some erratic things like vascular swelling and things like that flu doesn't cause. So you're looking at people having heart attacks and strokes and things like that kind of out of the blue because maybe they were asymptomatic, didn't know they had this. We have a stroke in a 36-year-old, and then we test and realize, oh, by the way, they had COVID-19. And it makes it an invisible war, like he was saying. With the flu, you can visibly tell that somebody's sick, so you kind of naturally try to stay away from them. Whereas with COVID-19, we don't know. That's great for a person. If they're asymptomatic, that's awesome. It's a nightmare for us. It makes it really hard to trace things and to do the investigation to figure out where it come from to start with. So that's some of the really big things. Like he said, this is so much more infectious and the mortality rate is much higher. So, there's thousands of people that die each year with the flu, about 20,000, but as we can see, we far surpass this with the COVID-19. So yes, definitely more infectious, a higher mortality rate, and there's a lot of unknowns still. So that's to answer that question. And there was a few things I just wanted to talk to you all about today and reiterate, and one of the big things is the mask. I know that we don't have a mandate in this county, but that is something that, like Andy was saying, that we can do to help our county. We're always saying, well, what can we do to fix this? This is something that each person can kind of take action themselves, and these masks really help. And a simple surgical mask, it's not a cure-all for everything, and there's still things that you get through. And I hear people fussing about, oh, well, if you get bacteria in your mask, you can breathe that in. So we also want to practice some common sense. If you've sneezed in your mask a whole lot, then it's probably time to get rid of it and get another one. Or if it's like a cotton mask, wash it. So have some common sense about your mask. Don't set yourself up for illness. But the big thing we're worried about is the droplets and the aerosol that people's talking about. And that is something we know. It doesn't matter if it's a sock you've turned into a mask. That's going to stop you from spraying those things out and also help from coming in. So the biggest impact is what's going out. Then also these masks do help protect what's coming in. So we don't mean to, but we all, when we're talking, how many times have you accidentally sprayed spit at somebody? You don't mean to, but it happens. And And that's what you can see. So think about more so what you can't see when you're talking, singing, playing, running hard, you know, things like that. It's gonna happen. So by you wearing your mask, you're not only protecting yourself from those droplets that you can see and can't see, but you're even more so protecting the people around you. So let's just not be selfish and be like, well, if it's not gonna protect me as much as it's gonna protect other people, you know, I wear my mask for my family. I also wear my mask for myself. But it's mostly, what can I do for my community to help this? So mask is an easy, simple way. Like Andy said, it's a little bit inconvenient, but you can hang it on the gear shifter of your vehicle, something like that, throw it on, run in the store, come out, take it right off. It's not like we're saying you have to wear it all day long. We're not saying you have to run in it or jog in it or anything like that. Just anytime you know you're gonna be in close proximity, it's just a respectful thing to do, we feel like, is to put that on. And some other things that I wanted to talk about, we have a lot of people coming through to get tested that's been contacts to somebody that is positive for COVID-19. And so I want to talk about the isolation on that. And a lot of people think that once they have tested negative, that means that they're done and their isolation is done. That is not the case. So one thing to differentiate, we all are, you know, have jobs, and some of us are considered essential employees and some of us are considered non-essential employees. And we don't mean that somebody's better than somebody else, it's just some jobs have to go on. So if for some reason you've come in contact with somebody that's positive for COVID-19, it is a recommendation, well, it's a requirement that you isolate for 14 days because the incubation period can last anywhere from 2 days to 14 days. And we also don't know, maybe somebody's become positive, but they're the asymptomatic. Just because they're not sick doesn't mean they can't spread this, it just means they don't look sick. So we, with the isolation period though, on average, it's about 7 days is what we're figuring out when most people become sick. But it can be up to the 14 days. So if you have somebody that's an essential employee, say you've got law enforcement, nursing, something like that, that if they're not there, people are gonna miss on services that they have to have for essential function of life, okay? So they're around somebody, they waited, you know, there's 7 days, they get tested, their test is negative. At that point, if they're an essential employee, they may have to return to work, but they're required to wear masks while they're at work and anywhere else that they're at. So just because they can go to work though, doesn't mean they need to be out running around at the grocery store, the mall, any places like this. That means they have to go to work and do their job, and then they need to come home. So 14 days for everybody. If you're an essential employee, that employer may require that you return to work. If so, work only and a mask. So that negative test is not a golden ticket that gets you out of everything. So a lot of people are confused about that. We need to do the isolation, and that's also what's hurting our numbers. We have a lot of people that are being non-compliant, and they're like, well, I feel fine. It's been 8 days, I feel fine, I'm getting out. Well, it's wonderful that you feel fine, but that's not wonderful for everybody else that you're getting out. So there again, let's just be respectful of others and have them do unto us as we would do unto them. I may have said that backwards, but anyways, and another thing about going back to work is retest. We've heard a lot of people say, well, my job said, you know, I was positive 2 weeks ago, I'm out of my quarantine time, I want to go back to work, but they won't let me come back to work till I have a negative test. That is something that we recommend not doing, and we actually have an official memo from the state recommending to not do that. And the reason why is the type of testing that we have that's readily available and that most sites are doing the testing on is what's called a PCR test, okay? And so that picks up on the virus, okay? But it does not differentiate between a live virus and a dead virus. So once you've completed your isolation, we're allowing enough time that we know that that virus is dead now in your body. So now you can return to normal society. But the problem is you come back in for that retest, you're still shedding that dead virus, you're gonna test positive again. So all we're doing is wasting tests. It's not very pleasant to get tested, so you're hurting your nose, and it can potentially spike the numbers. Now we try to link those to each other, but if you come in as Dave one day and David the next time, you know, it's kind of hard to differentiate that, so that can potentially throw our numbers off and skew them a little bit. So we're just recommending to not retest. That's one of the big things that we're asking. We're asking employers to not require that also, just to make sure they should be fine after that. All right, you all have any questions for me? All right, thank you.
Thank you, Ms. Megan. So next we have Mr. Tim McGill, Livingston Regional Hospital.
Thank you, Mayor. At LRH, we continue our universal masking policy inside our hospital. And this week I'll be sending out a personal letter to each employee, each medical staff member, and each board member, emphasizing the importance of wearing masks. I'd like to read an excerpt of the letter because it reinforces what Andy has mentioned about the wearing a mask. I want to stress to you the importance of continuing to practice in public places in our community when outside of work and wearing your mask. In addition to social distancing and proper hand hygiene, wearing face masks and cloth face coverings are one of the best lines of defense against COVID-19 until there is a vaccine. Again, I want to say until there's a vaccine. Wearing a face mask is one of the easiest and most effective ways we can protect, look out for one another at this time. So, as we mentioned earlier, I wear my face mask for myself and for the people I work with and around, for my family, and out of respect for everyone here today, because it's that important. It's so easy. It's not easy when you're the only one, though, at a meeting or a gathering, and you're the only one with a mask, but we're seeing that change, I think. Again, we continue our no visitor policy until further notice. I think we're entering a time when we have new normals, and I think limited visitation is probably in the horizon for healthcare organizations until a vaccine is developed and proven. So stay tuned for that. Hospital update, we have some new physicians I want to announce. Dr. Thomas Thacker begins August 1st. He's been recruited out of family practice residency in Nashville. Thomas is a native of Albany, Kentucky. He'll be practicing in Byrdstown, a member of our medical staff. We look forward to Dr. Thacker's addition as a primary care physician. Dr. Baron Herford, our newest hospitalist, began June 1st. He's a full-time hospitalist taking care of all hospital inpatients at LRH. And thirdly, our Oak Point Behavioral Health Unit construction project is underway. 95 days to go. We're hoping to open the new 6-bed addition around November 1st for patients 55 years of age and older. And I'm going to close by asking and thanking folks for participating in a recent American Red Cross blood drive earlier this month and giving donations. No better way to help each other than to donate blood. And again, we're asking for a mask in the community for using with our patients. If you're a community organization, a church, a sewing group, we would like for you to be able to donate masks to our hospital so we can use for every patient that enters our facility. Be glad to answer any questions.
As the cases increase, Coastal Regional has had an increase in hospitalizations. If we have an increase in hospitalizations, will we be equipped to handle those here in Livingston?
Yes, we have a designated inpatient isolation unit for COVID patients. It's separate from inside our hospital to take care of patients, up to 10 patients on a daily basis. Also, we have ventilators that we can use for patients that require that level of care. So yes, we're prepared. Okay.
Thank you, Mr. McGill.
Thank you, Mr. Mayor. Thank you.
Okay, next we have our Director of Schools, Dr. Mark Lane.
Thank you, Mayor. Good afternoon, everyone. I'll go as quickly as I can with an update from the school system. Our plan right now, as of today, which is subject to change at any time, we are planning on returning to school 100% on August the 7th. We are offering an option for anyone that has concerns about sending their children back to school, an online offering, and I'll discuss discuss that a little bit more in just a moment. We are sending out a survey, or it was sent out yesterday afternoon, allowing people to select which option they prefer. Registration date has also been changed to July the 20th. This will allow us to know the number of students that we can expect at school. Please return those surveys, and you do not need to do anything additional to register. Our original registration date was on August the 3rd. We'll still allow people to come and do that. If you fill out that registration before that, that's all you have to do. Registration paperwork and free school supplies may be picked up at each school during our back-to-school bash. Those will be held as drive-throughs at each of the schools on August the 3rd from 5 to 7 p.m. And parents are asked to pick up those packets and supplies from the school that their children will attend. Some safeguards for addressing COVID-19, I'll go over a few of those. Anyone that enters a building in Overton County Schools for the foreseeable future will have to have a temperature check. And if anyone is running a fever, we will have a place for those students or people to go where they will be separated from other students. If you think your child has been exposed to COVID-19, or if someone in the home has tested positive, parents should keep children at home for the 14-day period. During that time, they will be afforded the opportunity to do virtual education, and that will consist of exactly what the children are doing in the classrooms. School employees will be expected, they will be required to wear a mask, and that's all employees. Students will be strongly encouraged, but not required to wear a mask at this time. And again, that's subject to change. We will make sure that there is frequent hand washing and sanitizing throughout the school. And when practical, teachers will rotate rather than children rotating through the hallways. This includes the non-classroom teachers such as librarians, guidance counselors, PE teachers. They will go to the classrooms rather than students going through the hallways. Students will also, throughout the day, be given what we call brain or body breaks so that they can have some movement in the classrooms. We will also take up any porous surfaces. Many teachers like to have rugs and things like that in their classrooms. We're asking them to remove those things. We're also asking them to remove things from around the walls of their classrooms so that we have more room to social distance in those classrooms the best we can. We are not allowing visitors in the building with the exception of the first 2 weeks of school for those kids in kindergarten phase-in. We'll allow the parents to walk those children down to their classrooms for those 2-week periods, but we will ask them to wear a mask. Water fountains will not be in use during the school day. We're asking that students, parents provide a water bottle that can be refilled in the water stations that are in each of the schools. We also ask parents to transport their children if at all possible. Children who do ride the bus will be required to wear a mask on the bus. But we're asking parents, if you can at all possible, please transport your children. Morning drop-off and afternoon pickup procedures will allow for students to practice social distancing, and there will be specific areas where that will occur in each of the schools. And each school has been asked to limit hallway congestion. And again, buildings will be sanitized throughout the day, as well as each afternoon. And if we have students change classes, the teachers will disinfect those desks after that class is over. So before the next class comes in, the desk will be disinfected. And as I said, student desks will be distanced as much as practical, and an effort will be made to distance if we move through the hallways. Breakfast and lunch will be in classrooms, and/or outside. We're allowing teachers to take students outside for lunch. We're also encouraging on nice days, if the teacher would like to do that, they can take the class outside for a class. And so we're making every practical effort that we can. Okay? We are offering a virtual school option this year. It will differ greatly from what we had in the spring. What we plan to offer is an online instruction that allows students to view the same lessons that students are viewing if they are attending school. Okay? If students do not have internet access, we know we have many students that do not have internet access, we will provide USB devices that will have that content on those, and the students can complete that work that way. Students will be assigned a device or may use their own device for virtual instruction. We will be taking attendance through participation in the online option, and assignments will be completed just like they would if they were at school. Okay? We're asking that those assignments that they will provide assignments both online and on paper, and they will be identical to those that students who are attending school will receive. Okay. We are also offering a 2-week period at the beginning of the school. If someone wants to consider the online option, they'll have a 2-week period that they can try that, and if they consider that the best option, then by all means continue. If they do not prefer that option, they would rather a child be at school, they can return them after that 2-week period. And that's all we have as far as that update. Just a real quick update on athletics. Right now, any contact sports such as football, basketball, wrestling, any sport like that is limited in what they can do. Right now we're doing 10 people in a group, so that would be 1 coach and 9 players. And they're separated like they have been since the early summer. Golf and volleyball are continuing right now as normal, and that's what we will continue until we get other guidance. I will let you know that as we go through the remainder of the summer, which is very short, I understand that, we will be working with the local health officials and getting guidance from them as far as what we need to do going forward. Okay? And I'm open for any questions.
Megan?
Okay, so if a student or a teacher were to become infected, what's the contingency plan to mitigate further spread? You stated that there are, that they'll have to quarantine for 14 days. Will the other students or the other teachers be notified that they possibly came into contact?
There will be notification of that, yes ma'am.
Okay. Will teachers have a way to take a sabbatical or have an option to not put themselves in harm's way, much like you're giving the parents and the students?
There is that option. But they are, as of last night, they are considered essential employees. But we would consider that if they would like to pursue that.
Okay. And do you foresee a problem finding substitutes who will be willing to work in classrooms of possibly of children who have been exposed?
We do. Yes, we do.
Okay.
Any other questions? Okay, thank you.
Thank you. Next, we have Mr. Scott Stevens from Overton County Health and Rehab.
Hi. Thank you, Mayor Hayes, and good afternoon, everybody. To give you an update at Overton County Health and Rehab, we currently have no cases of COVID in our building, and beginning last week, all employees are tested every Monday morning, so 100%. If it's your day off, you come in and get tested, and I can tell you our first round of testing came back and everybody's negative. We have a new admission policy at Overton County Health and Rehab. We're starting to bring in residents, like from LRH and Cookeville, but there's a couple of things that we have to have from them. We have to have a negative COVID COVID test from the hospital. So we're not admitting people if they don't have a negative COVID test. And the other part of this that we're doing to really give ourselves an added bit of protection is we have set up a special wing for our new admissions. So they're not coming in as a new admission right into general population with all the other residents that have been living there. So once the 14-day quarantine, and this is a quarantine even with a negative test, once they've passed that 14-day, no symptoms, everything's good, then we'll move them out of that area into other areas of the nursing home. We've also updated our visitation policy. The last time that we met here, we had began allowing outdoors visitation in designated areas from a safe distance. With the numbers coming back up, we've postponed that, so there are no more outdoor visits. But we do continue to offer families the option to visit their loved ones via the video apps. If you have an Android device, then Duo would be the app to use. That comes on, loaded on Android devices. And if you're an Apple user, FaceTime works for that. And all you have to do is call. I'm going to be probably the one that'll take the device over to your loved one, and we'll get them on the video for you. So all you have to do is call, make an appointment. 823-6403 is our number, 823-6403. And we do that Monday through Friday, 8 to 4:30 p.m. Do y'all have any questions for the media? All right, thank you.
Thank you, Scott. Last but certainly not least is Mr. Greg McDonald and Shannon Cantor from the chapel.
Thank you, Mayor. Thank you, Mayor. Okay, I'm going to give a brief report, and then Shannon Cantor from the chamber will be concluding the report. There will be an economic recovery hiring event at Cookville Community Center, July 27th, 28th, and 29th from 9 a.m. to 2 p.m. So any employer, anybody that's hunting for a job, there'll be a hiring event again at the Community Center, Cookville Community Center on the 27th, 28th, 29th from 9 to 2. If any of our employers would like to have a booth in that event, I would just ask that they contact the chamber and we'll give them the information on who to contact. Also, there is a SBA Express bridge loan available up to $25,000. It is a loan, and the program, if anyone is interested in this program, again, contact the chamber and we'll send you the link to link that on, but it is a loan program, low interest, that through the SBA up to $25,000. To give the rest of the report to Shannon Cantor for the chamber.
Thank you, Greg, and good afternoon, everyone. To start this out on a positive note, the Chamber wants to thank the community for everything they have done through all of this in supporting our local businesses. Our sales tax revenue is up 25% from last year, which is it's something to be proud of. So we want to personally thank everyone for supporting our businesses here, and I am sure our businesses would say the same thing. So thanks to the community for that. Shopping local is definitely more important right now than anything. As far as unemployment, the latest numbers we have are from May, and we are down from 13.5 in April to 8.9%. Most issues with the website and the unemployment checks have been worked out by now. If you continue to have any kind of issues, you need to go to tn.gov/workforce/unemployment, or you can call 844-224-5818. The $600 that the government agreed to add to many of the unemployment checks, that will be stopping on the 31st of this month unless something happens and they decide to renew that between now and then. And if you are currently looking for a job, there are plenty available. We have gotten many calls from our manufacturers, some of our local businesses, and others in surrounding counties as well. There are plenty of jobs available. You need to go to jobs4tn.gov to search something you might be looking for, and that's jobs, the number 4tn.gov. Just a little bit on stimulus checks. I think the majority of the people have gotten theirs, but if you have not, go to irs.gov choose Get My Payment. Sorry, let me go back one. You choose Get My Economic Impact Payment. Then you choose Get My Payment. This website updates every night. At that point, it's gonna ask you for any of your information to identify who you are. It will tell you exactly what you need to do if you haven't got your payment. And it will also tell you, if they have all the information they need, what date your payment will be deposited into your checking account. And the Paycheck Protection Program, that is still underway. They resumed accepting applications on July the 6th. And the new deadline to apply is August the 8th. And if you want to apply for that, then just visit your local bank. And just a few other business resources for those out there who may need it. Through the Chamber, we have many partners that we work with on a daily basis, such as the Small Business Development Center, the Upper Cumberland Development District, the Biz Boundary, TVA, and much more. So if you and your business have concerns, please call us at the Chamber and make an appointment to talk with us, and we can possibly guide you in the right direction to help you and your business out. It's very important to remember we at the Chamber are here for our business community. And it's very important to us that all of you stay in business and that you grow along with the rest of the community. So if you have concerns, please give us a call. The number is 823-6421, and Greg and I will be happy to help you. And that's all I have. Thank you.
Any questions for Shannon or Greg? Okay, panel, again, great job, and thank you very much, all of you, for being here. Our next press conference will be August the 7th, noon here at City Hall. Is there any questions from anyone here? Okay, thank you everybody for coming in. Be safe.